Alprazolam, the active ingredient in Xanax, is a benzodiazepine, a class of drugs renowned for their calming effects on the mind. It is frequently prescribed to manage panic and anxiety disorders. In this video, we will discuss the pharmacology of alprazolam, including its potential uses and side effects, along with how it works. We will also discuss dosage instructions for alprazolam with the contraindication and its common interactions with drugs and food. So let's dive into it. Alprazolam is mainly prescribed to treat anxiety disorders such as generalized anxiety disorder and panic disorder. It is also used in the short-term treatment of symptoms of anxiety such as insomnia and agitation. It is also sometimes used to treat depression with or without agoraphobia and premenstrual syndrome. Now let's talk about how alprazolam works in our bodies. It basically helps a chemical in our brain called GABA, which is gamma-aminobutyric acid. GABA is a key neurotransmitter in your brain and acts like a regulator, calming down nerve cells by reducing their responsiveness when it binds to specific receptors. This inhibition helps maintain a balanced and controlled communication system between nerve cells, preventing the overstimulation. Now, what alprazolam does is that it binds to the GABA-A receptors in the CNS. The GABA-A receptor consists of various subunits which are classified as alpha, beta, gamma, delta, etc. And a common GABA-A receptor consists of 2 alpha-1, 2 beta-2, and 1 gamma-2 subunit. When alprazolam binds to GABA, it enhances its effects by increasing its affinity at the GABA-A receptor. Eventually, it leads to the calming or inhibitory effects of alprazolam on the human nervous system. Alprazolam is 80% bound to serum protein, mainly albumin, and it is metabolized in the liver by cytochrome P453A4 to 4-hydroxy-alprazolam and alpha-hydroxy-alprazolam metabolites. Finally, alprazolam and its metabolites are filtered out by the kidneys and excreted in the urine. Now, if we talk about the dosage and administration of alprazolam, it is taken by mouth as directed by the healthcare provider. The dosage is based on the patient's medical condition, his age, and response to the treatment. The dose may be gradually increased until the drug starts working well. An individual must follow the doctor's instructions closely to reduce the risk of side effects. For the management of anxiety, the usual dose is 0.25 to 0.5 milligrams 3 times a day for adults. Your doctor may increase your dose as needed. However, the dose is usually not more than 4 milligrams per day. For the management of panic disorder, the dose is 0.5 to 1 milligram taken in the morning once a day for adults. Your doctor may increase your dose as needed, not more than 10 milligrams per day. Now let's talk about the flip side of the coin. While alprazolam can help reduce symptoms of anxiety, it has several side effects, and if overdosed, it may cause addiction, suicidal thoughts, and death. The side effects of alprazolam include weak or shallow breathing, lightheaded feeling like you might pass out, seizures, hallucinations, risk-taking behavior, increased energy, decreased need for sleep, agitation, double vision, or jaundice. Its long-term use can lead to tolerance, dependence, and withdrawal symptoms upon discontinuation. You should not take alprazolam if you also take antifungal medications such as itraconazole or ketoconazole, or if you have a history of allergic reactions to any benzodiazepine. To make sure alprazolam is safe for you, you must inform your doctor if you have ever had breathing problems, drug or alcohol addiction, depression, mood problems, suicidal thoughts or behavior, or kidney or liver disease. Alprazolam is affected by drugs that inhibit or induce CYP3A4. Drugs that are potent inhibitors of CYP3A may increase plasma concentrations of alprazolam, resulting in increased adverse effects. Medications known to impact alprazolam include azole antifungals, cimetidine, certain antidepressants, macrolide antibiotics, rifamycins, seizure medications, antihistamines, and muscle relaxants. You must avoid alcohol while you are taking alprazolam because alcohol may potentiate the central nervous system depressant effects of this drug. You must avoid grapefruit products, limit your caffeine intake. So this was all about the pharmacology of alprazolam. If you have any concerns regarding alprazolam, you may consult with your healthcare provider. Till next time, if you like this video, please don't forget to like and subscribe. Thank you.